Hey everyone, welcome back to the Neuro Health broadcast. I'm your host, Dr. Joseph Kappas, and today we are joined by Dr. Robert Waterson of Synapse, Delaware. He's going to talk today about ADHD and primitive reflexes. So some key takeaways that you can expect from today are, what are primitive reflexes? How do we test for them? And then ultimately, how do we remediate them? And what is the relationship between having those retained primitive reflexes and ADHD? Dr. Waterson is a triple board certified doctor and holds two coveted postgraduate board certifications in clinical neuroscience and clinical nutrition. In his clinical experience, has gained the knowledge of treating patients of all ages and all conditions, including professional athletes in the NFL, MLB, and ATP, children with a variety of learning disorders, concussion patients of all ages, neurodegenerative patients with quality of life decline, and patients suffering from orthopedic pains, including neck pain, back pain, shoulder pain, hip pain, knee pain, and ankle pain. This was a fantastic episode. So if you are someone who has a child who is struggling with ADHD, it might be worthwhile to give this a listen and then seek care from someone who's well aware of primitive reflexes and what they might tell us about the brain. So after a quick announcement from our sponsor, Dr. Waterson with ADHD and primitive reflexes. This podcast is brought to you by Delta Neuro Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneurohealth.com. Hey everyone, welcome back to the show. We are lucky to be joined by our guest today, Dr. Robert Waterson of Synapse, Delaware. Thank you for joining us today, Dr. Waterson.
Thank you so much, Dr. Kopis. I appreciate being on the show.
Of course. So I'm really excited for what we have to talk about today because I know so many people are affected by what this topic is going to cover, and that is primitive reflexes and ADHD, right?
Yes.
Perfect. So before we get too deep into that topic, can you tell our guests a little bit about yourself, how you got into the world of neurology, and why you're so interested in helping people with ADHD?
Yeah. So everybody has a story, right? Just like yourself. So I played football for the excess of 20 years, and inevitably through that football journey, I experienced many head injuries and many different symptoms. The biggest one was dizziness, and I would go to vestibular PT and it helped. And there was this one time where I was walking out of vestibular PT and I was with my mom, and I was really dizzy in the parking lot. And I was like, there's got to be another way. There's got to be a different fix for this problem, as well as the other symptoms that I was having. Well, a couple years later, I was in a class called Protein Biogenesis taught by Dr. Cameron at Ursinus College, the college I went to. And in that class, we learned that neurons can regrow in the brain, called neurogenesis, and synapses can regrow in the brain, the connections between two neurons. And I furiously started Googling that, and I fell upon the Carrick Institute. And then that was my rabbit hole into chiropractic, the Carrick Institute, and then eventually clinical nutrition.
Mm-hmm.
Yeah.
Yeah. And that clinical nutrition plus the functional neurology tend to go pretty hand in hand, especially when it comes to treating these kids, right? Or adults.
Yeah. I see a little smirk on your face because you also have the clinical nutrition diplomate as well.
That's
So
right.
it's CFMP, it's a certified functional medicine practitioner.
Hmm.
So what that allows me to do is to do blood testing, urine testing, and stool testing. And we get an inside look at what's going on from a nutritional perspective. And then also a different lens that medical providers are I wouldn't say missing, but they're just not looking at. So that's what that allows us to do from
Hmm.
a nutrition perspective, looking at food sensitivities, looking at mold toxicity levels, looking at microbiome deficiencies, small intestinal bacterial infections, overgrowth, things like that.
Yeah. So even though this topic might seem straightforward from the title, obviously you can start to already see how this starts to layer onto itself. And I think we're going to be able to talk about quite a bit today that
Yeah.
people are going to get a lot out of. So, just right out of the gate, let's define primitive reflex and what that is compared to a typical reflex.
So a primitive reflex is a code that a baby's brain has in it. It's through innate intelligence, but it's a code that a baby's brain has in it to survive. So the first reflex I teach to parents, it's called the Moro's reflex. And it's when the baby is born through the birth canal and that head extends and the arms go out and the lung can expand and that baby gets that first breath of fresh air. And then all of a sudden it flexes back into that fetal position. That's that Moro's reflex. And the best part about that is that there's no higher cortical control of that. So it's an autonomic reflex that happens with no control of the high cortex, because ultimately that is not developed yet in the baby.
Mhm.
So there's several primitive reflexes that are pre-programmed in the baby that are appropriate. Another one is called the ATNR reflex, and it's for the baby to be able to corkscrew through the birth canal. Once again, no higher cortical function is needed, but it's autonomic and automatic control to be able to get through that birth canal. And the importance of the primitive reflex is that at a certain stage in baby development, in baby brain development, that primitive reflex needs to be inhibited. It needs to be stopped in order for higher function to be developed. And then when I'm looking at children, both children and adolescents and adults, if when I'm testing for these primitive reflexes, it's kind of like a marker for me to see whether that part of the brain developed appropriately or not.
Right. And through a normal birth, or we'll say a typical birth, vaginal
Yeah.
birth, those reflexes are kind of primed, right? Or you experience those reflexes. Can you talk about, maybe what might happen in an infant's brain if they don't go through kind of that more typical vaginal birth process, like a cesarean
Yes.
section?
So there are several reflexes that occur in the womb. And then several reflexes are occurring through actual birth through that canal. The asymmetric tonic neck reflex is one of them. The symmetric tonic neck reflex is another, and the Moro's reflex is another. They're big words, but ultimately it just means that it's controlling that baby through that birth canal. And if we have a cesarean section where that baby does not go through that birth canal and those primitive reflexes are not activated, there can be developmental issues that occur in sensory overload issues or ADHD and different learning disorders that are associated.
Yeah, and I'm sure we're gonna get into that because that's
Yeah.
one big part of this whole paradigm, right?
Yeah.
Okay. Okay. So we have those reflexes kind of at birth. They're helpful for survival, but ideally at some point, those reflexes should go away, right?
Yeah. So the best way that I explain this is that our development is like reading a book. So our brain is reading our DNA because we have DNA, and then the DNA makes cells. The cells make tissues, and the tissues make organs. So let's go back to the first step. The brain is reading the DNA, and in appropriate development, the pages are turned and then the paragraphs are read. But in bad development of the brain, you can have pages that stick together, or paragraphs that are misread, or pages or total chapters that aren't even read in that brain development. And what we're looking at in the research is what is triggering those pages to be turned. Those are called methyl markers, which gets into another deep topic. You can have hypermethylation or hypomethylation, too many methyl markers or too little of methyl markers. But in that developmental process, if we have the normal amount of methyl markers, we're reading that developmental book. And once that page is turned, that primitive reflex is supposed to be inhibited. Once that next page is turned, another primitive reflex is supposed to be inhibited. Another page, another primitive reflex. But if those pages get stuck together and that page is never read in that developmental process, these primitive reflexes are retained, or they're stuck. And then that's when we're seeing these primitive reflexes in adolescents and even in adults.
Mm-hmm. And
So
are we looking mostly at genetic factors? Are we looking at more environmental factors? Is it a combination of things that might affect that those methyl factors and the reading of the page, so to, like you said?
yeah, so that's another great question. So there's a huge debate in the research community of why are there more rates of ADHD diagnosis now compared to, let's say, 1960. And it is apparent that we have a better handle on diagnosing ADHD, and there's a bigger spectrum of ADHD, which we'll just focus on ADHD for now. So there's a bigger spectrum of ADHD diagnosis in 2023 than there was in 1960. But it's also inevitable that we have epigenetic factors. Epigenetics means that there are outside factors influencing our genetics that are causing hypermethylations or hypomethylations. And I have a list of them right here, but some of them can be pesticides. So it's inevitable that there's an increase in pesticide in 2023 than 1960. There's no debate about that. So what is the pesticide causing ultimately? Well, we are eating the pesticides, and it's known in research that the pesticides will cause hypermethylation in the DNA coding, which ultimately those pages aren't being read appropriately. Let's say a kid has that pesticide in them, and those primitive reflexes are being retained. So when I tell parents this, it's not that the primitive reflex is bad. It's that the primitive reflex is it's a red flag for me that there was a missed developmental process in that brainstem or in that higher cortex.
And then I'm glad you brought that up. So a parent might be asking themselves, these pesticides are everywhere. They're in the food, they're in the environment. Why my child? Why not? Maybe why my firstborn? Why not my secondborn? Why my son, but not my son's friend? What would you tell, I guess, that parent?
That's another great question. So that comes to a matter of resilience. So you can have different traumas that are affecting that DNA resilience. Whether that kid had a traumatic birthing experience, or whether that kid likes to play football compared to their second child, which might like to play another sport that does not involve physical trauma injuries. So it's a matter of DNA resilience. And sometimes you can have twins that go through the same lifestyles, and then one twin is heavily affected and one twin isn't, and ultimately that just comes down to DNA resilience.
Mm-hmm. Yeah, definitely. And even though patients may be in very similar environments, like you said, every brain is different. Our genetic makeup is a little bit different. Things are never the same in two different people. So it really takes somebody skilled like yourself to dive deep into what are the variables at play that we need to address.
Yeah.
So, and since we were talking about pesticides, I think a good caveat is talking then about gut function,
Yeah.
and how that plays into the development of ADHD or the retention of primitive reflexes. So how does that coincide, I guess?
Yeah. So I have all these little scenarios that I like to reenact for parents because I think that these really make it easy. So in the spirit of that, I'm gonna play it out for you. So our gut is like a fence, and an appropriate gut function, the fence will allow good nutrients through, and it will keep bad things in the gut and ultimately pooped out or urinated out. So when we have pesticides, that fence lining starts to become irritated, and the fence opens up. And there's these specific proteins called zonulins and occludins that will keep the fence tight. But the pesticides irritate it, and the fence lining starts to widen. And ultimately, there's pathogens or bad guys that get through the gut lining into our blood system, and we know once it gets into the blood system, it can wreak havoc in our brain. So ultimately, when we ingest these pesticides, it's not going directly to our brain, it's going into our intestinal system. It's causing irritation in the intestinal tract, getting through that proverbial gate or that fence into the bloodstream and then up to the brain.
Yep. And then that's where that gut brain axis comes in that so many
Yes.
people are becoming more and more familiar with. So you can see how it just becomes this negative feedback loop.
Yeah.
So going back to the primitive reflexes specifically. So let's say a child comes to you and their parent may suspect retained primitive reflexes. What are some of the things you would do to test for those things? And then let's talk about what your treatment approach to fixing that would be.
Yeah. So this comes directly from the great Dr. Robert Malillo. So I test primitive reflexes in a standing position. I'll test them on an all fours position, and then we test them in a supine position or on their back. So I have a list of primitive reflexes that I test. And once I get through that list, I can get an idea of if the primitive reflex is positive, where that primitive reflex is housed within the brainstem. And then ultimately, is it the midbrain that's causing the issue? Is it the pons that's causing the issue? Or is it the medulla that's causing the issue? So that's really my window into that brainstem using those primitive reflexes. So I have specific ways that I test them. They're not exclusive to me. Dr. Robert Malillo taught them. And they're also used a lot in the occupational therapy universe. And ultimately, if they're positive, then I know what level of the brainstem it is. And then I do traditional treatment involving exercises and remediation for that primitive reflex. But ultimately, I think where my strategy is unique is when we're able to use integrative strategies to influence the brainstem of where that primitive reflex is housed. Because ultimately, remember we said that the primitive reflex isn't the bad guy, but the primitive reflex is the ability to get a window into whether that part of the brainstem is developed appropriately or not.
Mm-hmm. And I know there are kind of two schools of thought in that, and some people really drive the primitive reflex remediation exercises.
Yeah.
Some people just go right for the part of the brain that is weak, that's allowing the expression of that primitive reflex to be.
Yeah.
And it sounds like you kind of do a combination of both. Is that right?
Yeah, so I have the luxury, since I'm a private pay practice, to be able to spend a significant amount of time with the patients. So I do both. We'll do traditional reflex exercises, and then I'll prescribe them for at-home exercises as well if I feel confident the patient understands or the parent understands to be able to do with the kiddo. But then I'll do those integrative strategies. So if we're looking at midbrain function, we'll do a lot of convergence and divergence exercises, pons. We'll do a lot of balance exercises, especially with the Bobo balance. I love that. There's a new technology called Bobo balance, which is basically biofeedback for balance on a TV screen. And then for the medulla, I'm doing a lot of autonomic exercises with stimulation of the tongue with SSEP, and then I'll integrate laser on all levels of the brainstem.
Mhm.
Yeah,
It's fantastic. Yeah,
yeah,
it's multi-layered, and then on top of that, you said you're You're also checking gut function, you're checking mold toxicity, infection, things like that. So very, very multi-layered approach that you're giving these kids and adults too,
Yeah.
because these primitive reflexes can still be retained in adulthood too. Is that right?
Yeah, I think that's surprising for adults is I'll get a lot of adult ADHD and they say that the medication is not working for them. And I'll say, well, take this ride with me and I'm going to test you for some primitive reflexes. And a lot of times they will have retained primitive reflexes. I'll do the neurofeedback approach, ADHD neurofeedback approach with them, as well as my usual ADHD approach. But then I'll just do some, I'll spice in some integrative primitive reflex therapies with them just to increase them through that success pathway.
That's fantastic.
Yeah.
Um, with I'm just gonna pause right there because I think one of the $1 million questions that I can ask, especially given the title of this episode, is how then do primitive reflexes go hand in hand with ADHD? Someone may be thinking, what does my startle response have to do with the fact that I can't sit still in class for more than 5 minutes?
Yes. So my response to that is that in baby brain development, we have growth of the brainstem first, medulla, pons, and midbrain. And through that process, each one of those houses different primitive reflexes, like we talked about. After that, the right brain grows first for about 2 years. And once the 2 years is completed of proper brain development, it switches over to the left brain at about the age of 2 years. Now, the right brain is responsible for global sensory function, facial recognition, and especially a lot of the processes of the first 2 years of life. And then once we switch over to the left brain, that's for very specific brain development function of speech, articulation, getting into specific brain processes. And then it'll switch from left brain to right brain, left brain to right brain, left brain to right brain. Well, if we do not have a properly developed startle response, like you're saying, then the right brain will not grow correctly, develop correctly in specific places, and then inevitably that left brain won't grow in specific places. So the research was trying to find if there was a specific place where ADHD occurs. And the research is mixed, but it's leaning more towards that there's no specific place where ADHD is housed, but it's actually the connection pathways between the left brain and the right brain. And the latest research is saying that there's a tendency for ADHD to be hyper-connected between that left brain and right brain through the corpus callosum. And what is found out is that that right brain switched over too fast and then went from left brain. And then we're getting this shoot back and forth because it's like, you develop, no, you develop, no, you develop, creating that hyperconnectivity, creating that ADHD, all coming back to the point of that startle response was never integrated appropriately. And that part of the brainstem was not developed appropriately. So it's a long-winded response, but it's really a story of going back to the original brainstem development.
Mm-hmm. And it takes someone such as yourself to really understand the deep aspects of brain development and then to be able to apply examination techniques to actually uncover where in the brain those weak points are or those underdevelopments, and then create an appropriate treatment strategy for that patient. Would you say that it's easy to come up with one protocol for for ADHD that you see, or is it pretty individualistic?
So every patient is really unique. I would say the only thing that I believe is appropriate for every patient is neurofeedback. I try to get every patient on neurofeedback, different protocols of neurofeedback, meaning that the channels are put on different places of the brain and the actual protocols within the software are different, but every patient, it's appropriate for neurofeedback. And then when they're on the active rehab floor with me, their protocols are all different. They're using similar technologies, but in different ways to stimulate different parts of the brain.
Mm-hmm. Yeah, it's so complex, so many layers, so many variables. You really have to have somebody who's working one-on-one with whether it's an adult or a child to get them to their goals. And speaking of goals, what are some realistic goals that patients can expect under this type of care? Should they expect immediate improvement? Like, should they expect long drawn out? What's the typical, I guess?
Well, I'll just restate research that Dr. Robert Malillo just posted. So they just did research. They took 120 kids under a protocol that is similar to mine. And they tested the 120 kids with the Wyatt scale and the Brown scale, both for the diagnosis of ADHD and learning disorders. And after 3 months of care, so that's 12 weeks of care, 80% of those kids dropped their ADHD diagnosis, and their grade levels went up 2 to 4 grade levels in that 12 weeks of treatment. Of course, there was a control group. That control group was tested in the beginning and in the end. Their ADHD diagnosis was the same, and they potentially even went down in grade level group. So that's direct research from Dr. Malillo. What I typically say to parents is that we're going to get them as neurotypical as I believe is appropriate, is the word I use. And then also what I'm seeing on the neurofeedback objectively, because we can look at the first brain scan, take all that data, and then there's an algorithm that the computer uses to look at the brain, the second brain scan, puts it together, is right around 60 to 70% change objectively. And then I tell them that as long as there's no head traumas from the child, neurofeedback and the therapies will last for 30 years.
Yeah, that's fantastic. And I mean, that
Yeah.
is very reasonable. That is very quick in the grand
Yeah.
scheme of things. And, if you're able to make lasting changes in such a short amount of time, I mean, that's fantastic. What more can you want, right?
Yeah.
Um, so we've talked about a lot of different things today so far. How do you actually approach that and make it digestible for the parent to
Yeah.
understand the game plan?
Yeah, there is so much information that has to be digested from the parent, but I try to make it as simple as possible. So I talk about 4 pillars. The first pillar is neurological. The second pillar is chemical. The third pillar is hormonal. And the fourth pillar is musculoskeletal. And I do the diagnostic procedures in those 4 pillars. And then also when I present my treatment plan, I present the treatment in those 4 pillars as well. But ultimately, my treatment strategy is 1 hour long. 20 to 30 minutes of that is neurofeedback therapy. And then 30 minutes of the additional remaining time is with me one-on-one on the floor.
So one of those 4 pillars you mentioned was chemical. So what does your analysis look like when you're approaching that particular pillar?
Yep. So when I'm looking at chemical, it's anything that can cause epigenetic factors or those methyl markers to be put on, and then in that proverbial book of development, cause those pages to be turned fast or not fast enough. So I do blood draws and stool tests, not in office. I'll send them to a LabCorp, but ultimately we're looking at IgG food sensitivity tests, IgG mold, IgG for heavy metals, and then the stool test is looking at 6 different columns, basically just microbiome and inflammation within the gut. But ultimately, it's what's causing those methyl markers to be disturbed.
Mm-hmm. And then once you're able to identify those markers, what are some of your approaches? Is it supplement based, dietary based, lifestyle?
Yeah, so food sensitivities is probably the most fun to look at, but the hardest to implement, especially with kids. It typically tends to be dairy and eggs, and eggs are in everything, and dairy's in everything. So the parents love to take a look at it, but then when the results come back, it's a hard implementation of food elimination ultimately.
Mhm.
In regards to the molds, I'm going to give a plug to Biocid and Botanicals. I have a certification in advanced mold procedures. And Biocid and Botanicals is a high quality supplement that's all natural. That's really good with removing the microbiome, or removing the biofilm, I should say, of the mold. And then heavy metals, once again, is a supplement. If it's needed where the mold or the heavy metals are too dramatic, I have one-on-one contact with the primary care providers, and we work as a team.
It's fantastic. And it
Yeah.
sounds like, just like when we're talking about which parts of the brain might be affected, really understanding that those chemical problems that may be going on. There's so many things that could be going on. No one step process, no cookie cutter approach. It's very individualistic, which is I think what these kids need, and it's so great that there are providers like yourself out there providing that care. Um, so we're running out of time, but I wanted to make sure we had enough time for you to leave any final words of advice or wisdom for patients or parents listening to this podcast. What would you say to them?
So if your child is experiencing learning disorders or ADHD tendencies, anything that is what you believe out of the norm, because ultimately the parent knows best. They know their child the best. It's important to get remediation as soon as possible, because leaving these lingering things going into high school or college, it's only going to get exponentially worse. And Dr. Carrick taught us that, especially in brain injuries, once a brain injury occurs, the only thing that's going to help that brain injury is appropriate neuroplasticity. It's not just going to spontaneously fix itself.
Right, exactly. Um, and I think when we're talking specifically about kids, anyone, of course, but especially kids, if you have a kid come into your office and they are struggling in school, they can't do what quote unquote normal kids are able to do, and you are kind of that crossroads. And if you're able to get them better, you can totally change the trajectory of their lives so that they can become high functioning, happy, uh, productive adults who live a fulfilling life. Like that is so rewarding, I think.
Yeah, and it totally changes the paradigm of the family as well, because a lot of these issues put so much stress on family life. So it's rewarding being able to change the child's trajectory, but also just change the paradigm of the family. And then also from the perspective of seeing of creating a team atmosphere with other healthcare providers in that circle, it's so much fun being able to collaborate with the occupational therapist and with the speech therapist. And I'm getting feedback now that's like, hey, this patient is getting the most amount of recovery they've had in a long time, and they just started seeing me. So it's
Mhm.
fun being able to collaborate and then create this team atmosphere, this fun atmosphere for the child, and change their lives.
Yeah, absolutely. That's why we got into it.
Yes.
um, Last thing, how can people find more about you, Dr. Waterson? How can they reach out?
Yep. So right on synapsedelaware.com, there's a messenger. You can message me directly. I'm usually the one that's looking at that, and I'll answer back personally on that. And then my email is synapsedelaware@gmail.com. So I can answer back personally on that as well.
Excellent. Well, this has been great. I really appreciate you coming on today. Fantastic episode. I know a lot of people are going to get a lot out of this episode. So thank you again. And then from your host, take care.